My goal is, especially in dogs, is never to have the glucose within reference range all the time. That's just a pipe dream in veterinary medicine. It's not going to happen. If you're poking your cat a lot every day in order to try and get them into remission, and then your cat is now hiding underneath the bed because they're scared of you, even if you get that cat into remission, I don't feel like we've done our job, because the quality of life has decreased significantly for both the cat and the owner, and they no longer have the bond. So we're not aiming for perfect. We're aiming for a good quality of life for our pets. Please do not feel guilty that you're not doing every single thing. Remember, I'd rather diabetes is just kind of a side thing and not something you're focusing on. So
when a pet is diagnosed with diabetes, most owners remember the moment. Sometimes it starts subtly, drinking more water, losing weight, just seeming off. And other times it's an emergency. A pet comes in lethargic, vomiting and dehydrated, and leaves with a diagnosis of ketoacidosis. The word diabetes can feel overwhelming. Injections, monitoring, costs, fear of complications. But diabetes is not a new disease, and it's not a death sentence. Today I'm speaking to Professor Patty Lathan from Louisiana State University. In this episode, we're going to unpack what's actually happening physiologically, how diabetes is diagnosed in real-world practice, and how to recognize diabetic ketoacidosis early, and what successful management truly looks like, especially in settings like South Africa, where insulin and diet remain our primary tools. If you've ever felt intimidated by this diagnosis, this conversation is here to give you clarity and better understanding. Professor Lathan, welcome to the Paws podcast. Why is this subject so complicated? Let's start there. Why do we struggle?
It's funny because this stuff just makes sense in my brain. But if you talk to me about trying to do a spay, let alone in a 50-kilogram dog, I'm going to be like, I'm out. Or talk to me about taking out teeth. So I think we all just have there are different things that make sense to us and that we can deal with really well.
I mean, we don't have the benefit of having access to some of the newer drugs that I'm sure you're going to make mention of today, that you spoke about in South Africa. We're a little bit behind with
Sure.
with all of that.
Sure.
So we are ultimately relying heavily on insulin therapy, diet, and sort of we are getting a lot better at monitoring. So we're definitely trying out our continuous sort of glucose monitors and allowing owners to be part of that whole process. But often when pet owners hear your dog or cat has diabetes, they are petrified. Is this part of the reason why we as practitioners also go, wow, there's just a huge amount of information to impart. How do you start? I know you see them as referral cases, but for those vets and pet owners, how do you calm them down?
Yeah, I think that's the first thing. The first thing is trying to calm them down. The first thing is getting owners to understand there's a huge difference between diabetes and regulation in dogs and cats and diabetic regulation in people. So, you know what? My goal is, especially in dogs, is never to have the glucose within reference range all the time. That's just a pipe dream in veterinary medicine. It's not going to happen. So, a lot of owners come in, they have friends or family or themselves have diabetes, and they see a glucose of, it's funny, some of them will see glucoses of 230 and they're panicking. And I'm like, that's a pretty good number for us. I mean, I don't want to be blasé about it. At the same time, I was always taught that a well-controlled diabetic had glucoses between like 80 and 250. And I'm like, I think sometimes they'll go between 80 and 350. If a lot of the times they're below the 350, then we're good as long as clinical signs are controlled. So I think the big thing I talk to owners about initially is I want to know if they know somebody diabetic or not, because that'll tell me where I'm kind of starting. Because if they know somebody diabetic, I need to talk them down and be like, okay, our expectations are very different. Dogs and cats typically don't get the same complications people do, partially because people live decades, right? Our patients live for a few years, so it takes a lot longer to get those long-term complications. And also, just to make sure they understand, we're not aiming for perfect. We're aiming for a good quality of life for our pets. And some dogs require being regulated more tightly in order for that to happen, and some dogs less.
And I think there's this huge pressure. I think I'm talking for myself here because maybe it's taught slightly differently, or maybe I was taught it by someone who put that kind of pressure on us, that if you are not managing these cases well, you are going to see sort of secondary consequences. You're going to see the development with the eyes. You're going to see urinary tract, UTI, bacterial infections. So I think maybe from that perspective, we have been really keen, like you say, of over-interpreting the glucose results and wanting to be proactive about it and get it right. Is that now totally changing? Is that one of the things that you feel very strongly about?
Yeah. So interestingly, in the studies, they're showing that diabetic regulation doesn't correlate with prevention of cataract formation. Dogs, unfortunately, 85% of them are going to develop cataracts within a year, regardless of whether you get them well controlled or not. So trying to get them tightly controlled to prevent cataracts isn't really a thing anymore. I actually saw some unpublished data that almost made it seem like maybe if you get them regulated really, really fast, that change in glucose in their blood actually made them more likely to form cataracts. So it's unpublished, so I don't know how accurate it actually is. But the point is, I don't think we have data at all to tell us the faster you get them regulated, the less likely they are to get cataracts. Also, with urinary tract infections, it's certainly something we think about, and certainly urinary tract infections can cause dysregulation. But I'm not sure that the quantity of glucose in the urine is directly correlated with how likely they are to get UTIs. So again, I mean, it makes sense, but what's interesting, we were talking about different drugs, the oral class of drugs for use in cats. That particular drug makes them basically pee out their glucose, right? So they've got a lot of sugar in their urine. And the studies have shown there's no increase in urinary tract infection rate after they start on the medication versus before, when they weren't peeing out quite as much glucose. So, yeah, I mean, I think that we had some reason initially to logically go, okay, well, if we get the glucose down better, then they're less likely to have these complications. But we just don't have the data to show that yet.
Oh, that's interesting. So before we go into some of the technical stuff for the listeners who are saying, okay, hang on, let's start at the very beginning. Some pets start with really subtle signs, and others sort of arrive as like major emergencies in emergency rooms. And we have a practice that deals with emergency work, so we see those. What are some of the early warning signs of diabetes that are most commonly missed?
Yeah, the biggest ones are going to be just the animal drinking more and peeing more. And sometimes owners will notice that over like maybe a few week period. Some of it's gone on for longer than that. And then they finally bring the dog or cat in when they just can't handle it anymore. Those are going to be the first sign. So again, without insulin, which is a hormone, that hormone drives sugar into cells. So without insulin to drive the sugar into the cells, all the sugar stays in the blood and it's peed out. So when you pee out the sugar, it drags water with it. That's why they're drinking more, they're peeing more. At the same time, they're peeing out their sugar, they're peeing out their calories, so they're going to lose weight. So the biggest signs initially are going to be drinking a lot, peeing a lot, and weight loss. And in the ideal world, we're going to catch these animals when that happens, because if it goes on for a while and then maybe they get some other disease on top of it, then they come into your clinic with diabetic ketoacidosis, which is when they're super, super sick.
So the cases that we're seeing that are presenting as emergencies are generally the ones that have not been detected in the early stages.
It's a combination probably of not catching it earlier, plus there's some concurrent disease. It's very weird. Like cats especially can have diabetes for a long period of time. They're drinking more, they're peeing more, the litter box is just getting soaked. But until they get something else like pancreatitis or some other infection or whatever, they may just continue drinking and peeing a lot. But once they get another disease and they get super stressed out about it, that causes diabetic ketoacidosis, which is when there are a lot of ketones in the body, which are acidotic, and then acidosis, right? So when they get more stressed, they cause other hormones to kick in, and that causes higher ketone concentrations, and then that makes them acidotic and they get super sick. So it's not just that they've been diabetic for a long period of time without insulin. It is also on top of that, there's some other underlying illness probably.
So you, just so that I understand this, so you're saying that generally there's something else that happens that takes a stable diabetic relatively into and tips them into ketoacidosis.
Exactly. Usually it's not just because they haven't had insulin for a while. Now, I mean, we could argue, and I'm sure if you have a dog who hasn't been treated for a year, then they're going to be more predisposed to other things. But yeah, generally it's pancreatitis is one of the biggest ones we see, which I think a lot of your listeners have probably heard of. Pancreas is a fickle creature in your body. It's an organ that makes digestive enzymes. And unfortunately, if a dog or a cat eats something, dogs are generally the ones that eat something they shouldn't. Sometimes it can anger the pancreas, and then instead of releasing digestive enzymes into the intestines, it just releases them everywhere, and it makes the poor pancreas hurt, basically. And then also the pancreas is where insulin's made. So it can also destroy the poor little cells that make the insulin. So then that makes it even worse. So pancreatitis is one of the most common ones we see, especially people that have schnauzers, unfortunately. They're cute little dogs, but they love to have pancreas disease.
Yeah, and we see quite a lot of pancreatitis secondary. And when we started, we were talking about braaiing as South Africans. And a lot of South Africans love to feed their pets from the braai, and it's often quite fatty meat. So, whether it's that or scavenging in the bins or, getting hold of something that they shouldn't, we see quite a lot of pancreatitis. So I can totally relate to sort of how painful these poor patients present.
Well, it's funny because literally there's we had a party for my wife's birthday on Saturday night, and we barbecued. We call them barbecues here, but we barbecued, and two of the dogs went into the crate before we went out to watch a basketball game. But then another dog, a friend's dog, wasn't, and I forgot the bag that had the trash in it and the pork chop bones and stuff when we came back, and he hadn't gotten much out, but there was a pork chop bone down there that hadn't been chewed on, so I didn't know what happened. So I told my friend, and this was Saturday. Today, here is Friday, and she texted me this morning. She's bringing him in because he's not eating, he's vomiting. I'm like, he's probably got pancreatitis. So it happens all the time with barbecues here too.
All over the world, see? We've got the same problems.
You look at me, I look at you, I see the love in your eyes.
Health you can see, love you can feel. UltraPet, the science of love.
So how do you explain DKA to an owner in a way that kind of conveys the seriousness, because these cases can go south, but also that it can be managed?
Yeah, that's difficult. I basically, there are a few things that have to be addressed. Number one, if your dog has diabetic ketoacidosis, or your cat, that means they are diabetic, which means the first thing that we need to accept here is that they need lifelong treatment for diabetes after we get through the diabetic crisis period. And that's really critical, because if people are unable or if they have too much anxiety associated with giving insulin injections, if there are no other options, which in other countries we talked about, we have oral medications for cats, but honestly, after DK, they're not an option right now. So pretty much if a cat or dog becomes a diabetic ketoacidotic, they are going to require insulin probably for life. Dogs, definitely for life. A lot of cats will require it for life too. So if the owner can't give injections to start with, that's something that we need. Honestly, unfortunately, we have to stop at that point. And it's unfortunate. It's just an honest conversation with the owners of, I don't want to put your animal through treating this DKA if when we finish, you can't give the injections twice a day or sometimes once a day. But I don't know how many times you've had clients that are like, I can't do it.
Yeah.
So that's the first thing, is your dog has diabetes or your cat has diabetes. And secondly, unfortunately, the diabetes has progressed so far, and there's another disease on top of it that's making it so your dog is super, super, super sick. Depending on, I mean, some diabetic ketoacidosis come in and they're just not eating. They had a little bit of vomiting, kind of like my friend's dog right now. And we can manage them with some fluid, some insulin, and then they go home in a day or two. There are other dogs that, are sick enough that they stay in the hospital 3 to 5 days or more. But what's important during that is not only are we diagnosing and treating the diabetes more intensively than we normally do, but we have to do other diagnostics to figure out what other disease is actually happening at the same time. And if we don't figure out what it is, it's hard to treat it, because in order to fix a DKA, not only do you have to treat the diabetes, you've got to treat this other disease. With pancreatitis, as well as I do, there's no magic bullet for that. It's basically time and fluids and pain medications and drugs to keep them from vomiting, drugs to help them eat, and maybe a tube in their nose to help them eat so that they don't get weaker throughout time. So unfortunately, it's not a short conversation. Typically, it's a longer conversation. I have no idea about economics in South Africa here. If somebody has a really mild diabetic ketoacidosis and a general practitioner is trying to manage it, they may get the animal out of the hospital for $1,000 to $2,000. When they come into our hospital, I don't know that we have any estimates less than $3,000 to $5,000 for it. So that's just a real talk situation with us. It's something that you're going to have to deal with financially as well. And again, I hate being so blasé about it and direct, but I also don't want to mislead people into thinking, oh, this is something they're going to be in the hospital for one day. They're going to come home. They're going to live happily ever after. I mean, 70% of them do live, but some of them don't. And again, the owner needs to understand, unfortunately, that there's going to be a lot of care afterwards. It doesn't just end with the diabetic ketoacidosis.
And the prognosis is guarded because, like you mentioned, some of them don't pull through it. And so the cost of that care doesn't magically go away. It still needs to be met. And I think, for us, that's where we also have to communicate. If we, like you say, if we're going to go ahead and set up that drip and start all the treatment, you need to understand that not only is this going to be this cost, it's going to be this, whether there's a positive or, we all want the positive outcome, but even
Absolutely.
in the event that your pet doesn't make it.
Absolutely.
So it is a tough conversation.
And some of them break your heart, but some of them also, you come in with a really sick dog that's really droopy and is a super sad schnauzer. And then 3 days later, they're bouncing around and their owner comes in, they go to see their owner, and, that's why we do it, obviously.
Yeah, of course. So we haven't tackled the difference and sort of how you manage the diabetic dogs compared to the diabetic cats, but ultimately it is very different. And I wonder whether this is also where some of the confusion comes in. We may have had a client who's had a diabetic cat and now they've got a dog and they're going, hang on a minute, this is not adding up. Please take us through the difference between dogs and cats when it comes to diabetes.
Yeah, it's a little complicated, but again, this goes back to, I think, people who have family members or friends that have diabetes understand this a little bit better, because when dogs become diabetic, it's because the cells in their pancreas that make insulin are gone. So dogs that become diabetic, they are 1000% dependent upon insulin injections for life. They're like juvenile diabetics, where in people, it usually happens because their immune system attacks their pancreatic cells that make insulin. In dogs, it's a combination of that. And I mentioned earlier, pancreatitis, just all the inflammation and the irritation from the rest of the cells in the pancreas can destroy the poor little cells that make insulin. So dogs, once they become diabetic, they require insulin for life. That's almost always irreversible. Cats are a little weird, which is not atypical of cats, right? Cats are always a little weird, or misunderstood, I think is a better term. Cats are more like humans, like adult humans with type 2 diabetes, where they have something that's causing inflammation. Something causing inflammation a lot of times that causes insulin resistance. So the pancreatitis could be smoldering, meaning it's not like super, super bad, but it's just there on a chronic low-grade level for a long period of time, but it irritates the pancreas, and then it causes these messengers, chemical messengers, to go to the body and say, ooh, I'm really irritated and I'm irritated. I'm going to make it so you can't respond to insulin well. So that's called insulin resistance. So lots of things can cause insulin resistance. But basically, a lot of times these cats can still make some insulin when we diagnose them with diabetes, but their cells don't respond very well. If we catch them early enough and they're the right cat, then even though we need to treat them in South Africa, it sounds like it would be with insulin initially. We have to treat them with insulin initially. Some of them eventually, when whatever's causing that irritation and inflammation goes down, say the pancreatitis resolves or they have an infection and we get rid of that. When we get rid of the cause of insulin resistance, they may go into diabetic remission where you don't have to give insulin anymore. Now, there used to be a huge push to try and push to get cats into remission. The problem that I found with it is that trying to get a cat into remission requires the owner and the veterinarian to work together to give the insulin appropriately, the right insulin, whatever insulin your vet recommends. And they've also got to do appropriate monitoring. It used to be glucose curves or even at-home glucose curves where the owner was checking glucose in the cat. Now we've got the Freestyle Libre, which is continuous glucose monitoring. Do you guys have the Libre?
Yeah, we've got access. Yeah, we've got access to that, which is wonderful.
Yeah, those ones are the ones that have been validated. People sometimes ask about different continuous glucose meters. We've also got something called a Dexcom, but it hasn't been validated for use in dogs and cats. So the Libre is not always perfect, but the point is, in order to get cats into remission, you've got to do a lot of monitoring and adjusting insulin. The owner has to be on top of it. Also, we generally make sure these cats are on a higher protein, low carb diet. And all of that together can increase the rate of remission in cats. The thing that I always tell people, though, is that if you're poking your cat a lot every day in order to try and get them into remission, and then your cat is now hiding underneath the bed because they're scared of you, even if you get that cat into remission, I don't feel like we've done our job because the quality of life has decreased significantly for both the cat and the owner, and they no longer have the bond. So even though they're now a non-insulin requiring cats, they aren't very happy. So we in the studies where they did a lot of that monitoring and such, they could get up to 60 to 70% remission rate. Studies in Europe showed really in a normal population of cats, we probably have like a 20% remission rate. And the reason I point out remission is a couple things. Number one, it's awesome if it occurs and you don't have to give insulin forever. Number two, it's important that we monitor cats' glucoses at least some, because cats can go into remission without you even knowing they're going into remission. And if you keep giving insulin when they don't need insulin anymore, their sugar can drop and they can have signs of low sugar, such as staring into space, not eating, vomiting, lethargy, and at worst seizures.
Gosh, so some very serious signs. And I mean, in terms of glucose toxicity, that's another term that comes up quite a lot. Why is early control so critical in cats, and how reversible is this glucose toxicity?
Yeah, so that's an important question. So we go back a little bit to pathophysiology, which I know a lot of owners really love pathophysiology and vets, to be honest. Okay, so I think of it as there are two major things that go on in the pancreas of cats when they're becoming diabetic. To make it kind of simple, basically you have this insulin resistance, right? This insulin resistance is making it so that the cells don't respond as well to insulin. So then what does the pancreas do? The pancreas increases the amount of insulin that it's making. So it's going to help decrease the blood sugar. And that's a good thing initially. However, as it continues to increase insulin secretion, there's something that's secreted with it called amylin. Amylin's a protein. It helps to decrease blood sugar. But unfortunately, when a lot of amylin's made, it can get together, it can aggregate, and then go back to the pancreas and form amyloid. And amyloid is what is found in the brains of people with Alzheimer's. So amyloid, unfortunately, causes irritation and inflammation to the cells of the pancreas. And when there's a lot of amyloid on there, it just kills all the poor little beta cells. How much is present in each cat at diagnosis of diabetes? I don't know. So that's one thing that's affecting the pancreas in cats is amyloid deposition. Now, the other thing is as you get more amyloid and more insulin resistance, then the poor little pancreas just can't keep up with the blood sugar. So eventually the blood sugar starts going up a little bit, like not super, super high where the animals are clinical for their diabetes and they're having signs and symptoms of diabetes, but it's going up a little bit such that that glucose in a very weird way is actually poisonous or toxic to the poor little beta cells. So as that blood sugar goes up, the beta cells undergo this glucose toxicity. Now, this goes back to your point of reversibility. When amyloid deposition occurs, any beta cells that are killed from that aren't coming back at all. They're dead. They're gone. But glucose toxicity, we think if it's not too severe and if it hasn't been going on for too long, then it might be reversible. So that's kind of our goal when we start treating cats is to try and get the glucose down so that if they have a lot of glucose toxicity, we can reverse that and their beta cells are then going to be able to recover and become healthy again and make some insulin. Again, I don't know how much of their beta cells that make insulin, I don't know how many of their beta cells have been wiped out by the amyloid. And if 95% have been knocked out by amyloid at that point of diagnosis, we're not getting them back. But say it's 50% are knocked out by amyloid and 50% are undergoing glucose toxicity, and we can reverse the glucose toxicity, then that cat has a chance at going into remission. Does that make sense?
So you obviously, yeah, it does. And if you can't obviously test for amyloid, does MRI or ultrasound, is there anything that you can see visually that might indicate?
Unfortunately not. Right now, we don't really have a test to do while they're alive. I suspect if we went in and biopsied the pancreas, that would give us an answer, but that seems pretty extreme for these cats, unfortunately. I was just at dinner in Vegas talking to a friend that works for a diagnostic company, and we were talking about measuring C-peptide, which is something related to how much insulin the cat's making. And if they could come up with a test for that, that would be super helpful for us in determining where cats are in this process. But we don't have it right now.
The future. Give us a little insight into.
So it's pretty much we treat all the cats like they could potentially go into remission. But again, it kind of depends on the cat. If I have a cat, there are different kinds of cats, right? There are some cats that love you to death. They don't care if you poke them. They don't care if you prod them. They will be your friend forever, no matter what you do. Those are the cats that I feel like we can adjust all different things in them and maybe try harder to get them into remission. Then we've got the cats that are sitting in their crate and they're trying to strike at us when we come near them when they come to the vet clinic. Now, with those, they're a little bit harder. Some of them are nice at home. I have one of those that turns into a demon in the vet clinic, but is the sweetest cat on the planet at home. If the owners can do stuff at home without the cat getting angry about it, then that's good. But if not, then I'm not going to push them really hard. I'm just going for clinical control.
So let's talk about the diagnosis in sort of general practice. What makes it relatively straightforward and what can be tricky, particularly when it comes to our special cats?
Yeah, so dogs are pretty straightforward. If you have high blood sugar and you have sugar in your urine of a dog, then that's the diagnosis of diabetes. Actually, that's what diabetes mellitus means, is like water comes through the kidney and into the urine. And, there are all these rumors of the initial test for diabetes was somebody tasting the urine, which is absolutely disgusting. Actually, I think one of them, one person discovered there was sugar in there because ants went to the urine when the dogs urinated. Yeah, super bizarre. Anyway, wow. So in dogs, it's pretty easy. If they have the typical symptoms and then they've got sugar in lots of sugar in their blood and in their urine, then the diagnosis is easy. Cats like to be tricky. People get something called white coat hyperglycemia, which for the lay people, it's white coat high blood sugar. So what happens is when we go to a doctor, we're all like, most of us have a little anxiety about going to see the doctor. And they've shown that if they measure our blood sugar at home versus when we see a doctor, our blood sugar is higher when they see a doctor. Now, I doubt that our blood sugar gets as high as cats do, but it's the same thing in cats. When they get stressed out and they go see a doctor, their blood sugar can be super, super high. So, if I've got a cat who the owner brings in and they're like, he's been drinking a lot, he's been soaking the urine, he is also losing weight, and also in cats, they can walk funny on their hind limbs. We call drop talks. If all of those things are present and the history fits, and the cat also has a high blood sugar and sugar in the urine, then I'm going to say, yes, this cat has diabetes. But every once in a while, we have cats that come in where the owners don't know how much the cat's drinking. The owners don't know how much the cat's peeing because the cat is urinating outside or something else. They just know the cat's losing weight. And then we measure the blood sugar. And maybe it's one of these cats that, because it's an inside-outside cat, it's not handled a lot, so it's super scared. And the blood sugar is really high. And then there's sugar in the urine. Then we're like, is that really a diabetic cat? Or is it just a really, really stressed cat? So in those ones, there are a few things we can do. Number one, sometimes the blood sugar will be high, but there's no sugar in the urine. And then that's probably not diabetes. The other thing we can do is we can have the owner check glucose at home. I'm assuming you have I know you have different types of glucometers there, but Alpha Track is there. So validated for use in dogs and cats. So it's pretty easy for owners to get a sample from their cat's ears. I was just laughing because I had to do this a few weeks ago in our cats, because there are 5 cats and somebody was drinking and peeing a lot. It turned out to be for some other reason, but every single one of them got their blood sugar checked. And of course, I'm used to doing this. My wife is not. And she was just like, okay, I'm holding. But it was a pretty easy process. So my point is that you can have owners check a blood sugar at home with an Alpha Track if possible, or you can measure something called fructosamine, which is kind of like people when they measure A1C. A1C is very similar. It's just a little bit different than in dogs and cats. In dogs and cats, we run fructosamine, which basically will tell us how high the sugar has been for like a 2-week period. So when you just check a glucose in your cat, a sugar in your cat, like right now, you just know how high it is at this moment. In 2 hours from now, it might be completely normal. But if you measure a fructosamine, that tells you how high it's been for the 2-week period. So if it's been high for 2 weeks, that tells us that cat is diabetic. If it's not high, then it's probably a stress hyperglycemia case. So that was a really long explanation to say that cats can get stressed out and have a high blood sugar at the vet. Dogs don't typically do that, but if cats do it, there are some ways to differentiate whether it's diabetic or stress.
And for newly diagnosed diabetic patients, what is the minimum diagnostics that should always be performed?
Yeah, that's a bit of a fuzzy question. What I would do in all of mine, and remember, I work in a university. We call it the ivory tower, right? Where we try to do everything gold standard, right? So for us, and usually in most vets, if a person brings in their cat or dog and they're really worried, they're going to run a blood count to give them an idea what's going on with the red cells, the white blood cells, any signs of infection or anemia. And they're going to run a serum chemistry to give us an idea what the sugar is, the liver enzymes, the kidney enzymes, or the kidney values, and the salt concentration, so sodium, potassium, etc. So I would run a CBC and serum biochemistry and check the urine. That to me would be the minimum database. But in actuality, and the reason for that isn't just because I'm trying to waste people's money. It's because I'm trying to see if there's something else going on. Because as we discussed, diabetic ketoacidosis occurs when cats and dogs have another disease on top of it. So if I'm diagnosing a diabetic patient, I want to look and make sure that I don't see other things going on that I need to address to make sure that they don't go into decay. At the same time, when the cat comes in or the dog comes in, they don't usually, have a label on their head that says, I have diabetes. So I'm really checking a lot of things to make sure, like, they're drinking and peeing a lot. I want to check their kidneys. So that's the baseline I would do. Now, if push came to shove and I was really trying to do things on the less expensive, making sure they have sugar in their blood and sugar in their urine is the very minimal that you have to do to diagnose it.
And how often do concurrent diseases like hypothyroidism and then pancreatitis or even infection complicate regulation?
Oh, I'm conflicted here because I live in a very biased world where I see the animals that have the more complicated conditions. And I don't know necessarily numbers. I'm just making a guess that 20 to 30% of animals have concurrent illnesses. Now, dogs, in dogs, again, I don't know the percentage, but a decent percentage of them also have Cushing's causing it. But again, I'm the one who sees the dogs that have Cushing's and diabetes. So I probably have a skewed perspective. Most of the cats with diabetes aren't hyperthyroid. Most of the cats with hyperthyroidism are not diabetic, but I can see those together sometimes. Now, pancreatitis, I'm not going to give you an accurate answer to this because I think there's a lot of subclinical, meaning very, very mild pancreatitis that's kind of underlying the diabetes in a lot of animals that we just don't know is there. And really, we don't have a direct treatment for it. So whether it's there or not, we're not going to do anything differently.
But once a diagnosis is made, you've spoken a little bit earlier, what does successful diabetic sort of management look like in real life rather than that whole textbook perfection?
Sure. Yeah, that's a perfect question. So for me, in a dog, I'm generally going to ask about diet and make sure the dog is on a high quality diet. Now, there are some diets out there that have lower carbohydrate content. I actually have it's cat diet, but I have some Royal Canin in the United States has recently come out with a new diet that's lower carbohydrates for dogs as well, and higher fiber. But you know what? In dogs, I don't insist that they change diets. If a dog, especially if you've got a picky eater, little dogs, I have 2 little dogs at my house. If they became diabetic, my primary goal would be to make sure that they're eating twice a day rather than they're eating exactly what I want them to eat twice a day. So people talk about diet a lot, and it can absolutely be an important part of the regulation. But initially, when I start treating the animals, that is not my primary goal. As long as they're eating a good approved diet that's not, I don't know what the equivalent would be in South Africa, but we've got Walmart here and that a huge department store, and they have a brand of dog food called like Sam's Choice. And I always tell people, I'm like, they can't be on a super low quality diet, but a Purina diet or something that just, is a good type of decent quality diet is fine. But then other than, so my point is that a lot of vets, I know one of the first things they do when they diagnose a dog with diabetes is change the diet on them. And I'm a little hesitant. I would rather not change everything at once. Let's start off by starting the dog on insulin. Let's start the dog on insulin. Generally, we're usually using twice daily insulins. And after we start the dog on insulin, we're going to have the owner monitor the dog at home. They're going to keep track of clinical signs every day. Either they're doing it on a spreadsheet, they're writing it in a journal, etc. My goal for this dog is to get rid of the clinical signs. So I don't want the owner to have to get up multiple times in the night to let the dog out. I don't want the dog to have to be drinking all the time. I don't want the dog to have accidents in the house. I want the dog to stop losing weight because of his diabetes. Now, later on, we can deal with it if it's fat. We can deal with getting them to lose weight, but not right now when we're trying to get them regulated. When we're trying to get them regulated, I want the signs that the owner's noticing to go away, and I want to make sure their blood sugar is not too low. I mean, really, those are my two primary goals, is happy dog and a not low blood sugar dog, which then is going to make a happy owner. Now, I make it super simplistic, and there are lots of variables in there, right? But at its base, if we can control a dog on the dog's normal diet, adjusting the insulin, and they don't have any clinical signs of their blood sugar is not going low, I feel like we've succeeded. With cats, I typically do try to change them to a higher protein, low carb diet, low carbohydrate diet, because these diets have been shown to increase remission rates in cats. So I think they do better. Cats don't have the same enzymes to process sugar that dogs and humans do. So when they become diabetic, that becomes much more of an issue. So I try to get them on a low carbohydrate diet. But then also initially, they're generally going to be on insulin twice a day, unless you have the new drugs that we have over here that are actually oral medications. Again, those drugs are not going to be used in cats that have had DKA before, but they can be used in other animals. I imagine eventually it'll come to South Africa. I don't know what the timeline is for United States to. You're like,
Very frustrating.
I know that
Years and years.
they were released. I was lecturing in Australia in August, and they were released in Australia around that time period. I don't know if the Southern Hemisphere is on the same timeline or not. You're like, no.
I wish.
No,
We're always the last to get our stuff. But we are patiently waiting, and we will be very grateful when it does arrive. So
they are potentially life-changing. So something for people to pay attention to. But when you do get these oral medications, it is imperative that owners follow the exact direction that the vet gives them. That's the big problem we see in the United States, is when owners don't bring their animals in for rechecks, their cats, and things like ketones going up over time are what we measure. And we can catch them before the animals have a problem. But if the owners won't bring the cats back in for rechecks, then we can miss the problems before it's too late. But otherwise, they're super successful.
incredible. And what do you find are the most common, I'm using the word mistakes again, but what do you find are the most common mistakes veterinarians make in the first few weeks of treatment, other than the dietary change?
Yeah, I think trying to change too much and obsessing about numbers. Those are really the big things. I mean, when I was taught a while back about diabetes, it may be that the people that taught me talked about making sure the clinical signs were controlled. But what went into my head was, okay, I need to get the sugar between 100 and 250 throughout the day, or that's mgs per deciliter, obviously. So y'all are in different units, but I need to get, are y'all in millimoles per liter?
Yes.
Okay. So 5 to 12 or something like that for y'all, millimoles per liter. But that's what I was obsessing about, was getting the numbers right. And then over time, number one, I realized I could, that was a pipe dream. Like, I was never going to get the numbers perfect in most of the animals. And number two, really what was more important was to focus on how the animal was doing. So, over the years, I think that vets have gotten better. Like, I used to get people that would text me, hey, I have this diabetic that's coming in for a recheck. These are the numbers on the glucose curve. And I'm like, how's the dog doing? What's happening to the weight? And they're like, oh, I haven't talked to the owner yet. I haven't weighed the dog yet. And I'm like, that's more important than the numbers. But again, I went through the same phase, so I totally get it. But I think the biggest problem is people looking more at numbers and not focusing on how the animal and the owners are doing. I mean, treatment can be life-changing. I had a dog that was on Lasix. So this dog was drinking and peeing a ton, and I was having to get up in the middle of the night once or twice a night. And the effect on my own quality of life, having to get up every night was ridiculous. I mean, the dog had his own problems, but I think just improving little factors in quality of life for the dog and the owner are huge. So yeah, I think that's the big thing is trying to focus on the numbers versus the clinical signs. The biggest problem I see with initial diabetic regulation. The other thing is we need to make sure, obviously, the owner knows how to give the insulin. Make sure that you watch them give something in the room. Usually I'll have them pull up some sterile water or something to show me they can either give it to their dog or cat, or if we have a clinic dog or cat there that's very tolerant of injections. Because lots of owners, understandably, are scared to death to poke their own animal because they think they're going to hurt their dog or cat, which I totally get. I mean, I wouldn't want to hurt my dog or cat either. But I also know that the dogs in my house don't really care if they get poked with a little insulin syringe. It's like they barely feel it, especially if you have somebody else there that's like, here's a treat. At the same time, a diabetic dog is usually going to be wanting to eat a lot. So you give them the injections, but you do need to make sure that the owner knows exactly how much insulin to give. Because I've certainly seen problems where an owner was told to give 1 unit of insulin and they were giving 10 units of insulin. So you need to, and we need to make sure that the owner that's actually giving the insulin is at the clinic. Because how often do we have it where, you know, maybe one owner is the one that takes care of the dog all the time, but that particular owner can't bring the dog to the vet. Then you talk to the person who doesn't take care of the dog. They come to the vet and you're like, are you giving this much? They're like, yeah, I'm giving this and this and this and this, only to find out later it's a different person. So also, if you show the person who's not going to treat it how to give the insulin, and then the other person's giving the insulin and they give 10 units instead of 1, we get into a big problem. So making sure that we check when the animal comes in initially and then during the recheck that the owners are actually giving the right amount of insulin. That sounds so silly, but so basic. During COVID, that was a bigger problem because people weren't coming into the clinic and they weren't being able to like show as well. And I saw a little bit more complications there.
And we've had an owner who used to close her eyes as she would inject. I mean, I understand. I do understand,
yes.
But obviously you need to look. You need to look. So
insulin
those kind of things happen.
On the skin does not help the dog.
No. So how do you approach insulin selection in dogs and cats if you have choice?
I try to make it simple for most veterinarians. In dogs and cats, I have kind of my 2 top insulins I start with for twice daily. Then there's other insulins, which gets a little complicated because availability throughout the world is variable. So in dogs, cane insulin is one of them, or Vetsulin is what we call it here. That's one of the first ones I'll start using. Also, NPH insulin, which is either Novolin N or Humulin N, is what we've used for years. I know in Australia next year that's going out. They're not going to make that anymore, which is one of the reasons we use veterinary approved products a lot because those companies keep it. So Vetsulin or cane insulin. And then I don't know if y'all have Prozinc, PZI insulin.
We do.
So in the United States, that's also approved for use in dogs. Actually, as a once a day insulin, it'll work in about half of dogs once daily. For cats, I'm either going to start on Prozinc, 1 unit twice daily, or Glargine, which is Lantus here, 1 unit twice daily. The choice is totally up to the vet. I tell a lot of people, I feel I try to support veterinary companies more because of the fact that they're putting the money into the research. They're putting the money for us into continue education. And full disclosure, I get sponsored by these companies too to speak a lot of times. But if you use a veterinary insulin, the syringe is different than if you use a human insulin. So the concentration of insulin is different with cane insulin and Prozinc versus with NPH and Glargine. So often I'll be like, you know what, y'all should have a veterinary insulin in the clinic. So Vetsolin and Prozinc would probably be my choice. Vetsolin for dogs and Prozinc for cats. And then if those don't work, because the thing is, you've noticed in humans, there are 8 gajillion different types of insulins available because the same insulin doesn't work in every different animal. So if Prozinc doesn't work in a cat, then I switch them to Glargine. If Vetsolin doesn't work in a dog, I might switch them to NPH insulin. There's another one out right now called Degludec, which I use a lot in dogs. That's an insulin that works once daily as well in dogs. So really, I usually choose between one of the 2 starting insulins. Cats is going to be Prozinc or Glargine. Dogs is going to be Vetsolin or NPH. But I also, in dogs, when they come to see me, will use Degludec, but they have to have a Libre on if I'm going to use Degludec.
And how important is consistency in feeding and timing?
Yeah, that's a really good question. And this is another thing that I think owners get confused about. I feel like I have 2 types of owners. I have the types of owners that if I say every 12 hours, twice a day, they will reschedule their lives to give insulin at 7 a.m. and 7 p.m. And then I have the type of owners who are like, I'll give it at 7 in the morning and then I'll give it at 3 p.m. And neither of those are perfect. I mean, obviously the first one from a medical standpoint may work better for the dog, but long term, that's not achievable with consistency because those poor owners burn out. I see them and they're at their wits' end. Whereas the second one, if you're giving it 16 hours apart and then 8 hours apart, that's not good either because these insulins are meant to kind of last 12 hours. They are never exact. But the point is, what I usually end up telling owners is give it about every 12 hours within an hour of each side. So if you're choosing 7 a.m. and 7 p.m., give it between 6 and 8 a.m. and 6 and 8 p.m. in general. If you can't do it during that time period, I mean, within a few minutes is fine. But if you're not gonna be home at night or something, and you've got somebody else watching the dog, it's not wrong to skip 1 dose of insulin. It's not the end of the world. As far as feeding, what we've historically told people to do is feed before they give insulin in dogs. And I think that's fair because if the dog doesn't eat with these twice daily insulins, then you risk the glucose going too low. But if you have, say, a Labrador that eats very consistently and you're never worried about it, it's also not wrong to give the insulin first. And sometimes, I pay attention to what happens on the curve. Sometimes they eat, their sugar goes up so high that if you haven't given the insulin already, you can't counteract that. Sometimes it makes a difference clinically and sometimes it doesn't. So sometimes I give the insulin first. But getting back to your point, consistency is really the key here and doing it pretty similarly every day. Now, dogs, I feel generally, we can get dogs to eat 2 meals per day. Different dogs are different. The dogs in my house, they don't usually eat breakfast, they eat dinner. So there are some things we can do to work around that. Cats are a whole different beast. Yes, I'd like them to get some canned food twice a day, but if a cat is a grazer and is going to be eating all day and won't eat twice a day, that's just what they're going to do. I am not going to try and change that because cats, unlike dogs, although some dogs will do this too, if you don't give the cat what the cat wants, the cat will just go on a hunger strike, and that's just a worse situation for everybody. Dogs usually will eat eventually, but again, little dogs. I've got a Yorkie and a Shih Tzu Bichon at my house right now, and if the phase of the moon is not right, they may choose not to eat. And whereas a Labrador, which is my favorite dog on the planet, they're just going to eat anyway. So I know I'm kind of all over the place, but my point is consistency is important. With dogs, feed twice a day. Cats, you can let them graze.
Excellent. And how has continuous glucose monitors improved diabetic management? And are there any issues with the fact that we are now just bombarded with additional information that we want to act on? That's
a really good question. So I think that the Freestyle Libres, the continuous glucose monitors, have both been a blessing and a curse at the same time. So on one hand, I mentioned the glucose curves easier initially, which basically is you check a glucose every 2 hours in a dog or cat throughout the day for about 12 hours. Those were the things we were doing for years because we thought they were pretty accurate and such. What we found out, though, looking at some other data, is that giving the same amount of insulin with the same food every day even, their glucose curve is very different from one day to the next. So they did a study where they showed that only half the time from one day to the next would a veterinarian make the same decision on how to change the insulin dose. 25% of the time, they might have changed the insulin one day to go up, and the next day they would have made it go the dose lower based on these glucose curves. So those were really frustrating. The nice thing about Freestyle Libres is they'll check glucose sugar every 15 minutes for up to 10 to 14 days. Now in cats, they last maybe 3 to 5 days. Dogs, they may last 7 to 14 days, but it depends. And these devices are made by a human company that will not provide any support for dogs and cats. So number one, that means if you call the company and tell them something happened to your dog's sensor, they're going to be like, sorry, can't talk to you. I have had people who called and said, hey, my sensor's not working anymore, and they sent them a new sensor. So I'm not telling people what to do, but that's what I've heard happen. So on one hand, these can be absolutely amazing because you can see kind of on average what they're doing over a couple of weeks. And if you see the glucose is going really low sometimes, you know not to increase the insulin dose. So that's super helpful. The problem is I do see some vets, and actually this is often owner driven. Owners see the glucose went up to 350 at some point and they're calling, panicking. And I'm like, what does your dog look like? Oh, they're wagging around chasing the ball. Well, it's fine. It's really hard a lot of times to get owners to understand that a high sugar is not something to panic about. Now, if the sugar is super low, I'm more worried. But this is, again, where the Libre can be super frustrating because the number of times I've had a Libre tell me the sugar was 40, which is about 2.5 millimoles per liter, and they're panicking about it when actually I go and measure it with a glucose meter, a sugar meter in the clinic, and it's say 120, so around 6 for y'all, 6 millimoles per liter. It's ridiculous how often it lies to me and tells me it's super low when it's not actually low. So what I also tell people with that is if you see a super low reading, but your dog is looking happy, it's good for you to have something that you can measure. I keep pointing to my ear because that's where we usually take the blood from in these dogs. It's good for you to have something where you can measure sugar at home to see whether it's really low or not. So the good things about the Libre is they're very good at showing you trends in where the blood sugar is going. The bad thing is when people are obsessing about very specific numbers or when it lies and tells us that it's super low when it's not super low.
And when it's working as it should, how do you approach a case that isn't regulating as expected?
Yeah, so generally with these twice daily insulins, I change the insulin up to every 5 days or so. So what I usually will do is I'll put a dog on insulin, wait until I get to 0.5 unit per kg twice daily. And then if they haven't had any improvement, put a Libre on. Then if I see the glucoses are all super high, I'll go ahead and increase the dose. And then obviously talking to the owner about signs. And then if the sugar is still super high 5 days later and you've still got the Libre on, I can increase the dose again. So you can increase the dose several times with one sensor on them. So that's what's super convenient. But once the animal starts showing that the sugar is going to the low end, so say around 80 mg per deciliter or 4 to 5-ish millimoles per liter, then I don't want to increase anymore because the biggest thing is, again, control the clinical signs, but don't make them go too low. So that's what the Libre is good for. And of course, if you don't believe the low number, you've always got to check it with an alpha track. But that's the simple method is you increase the dose every 5-ish days until you have them either controlled or their glucose is going down to 5 millimoles per liter. Then you don't want to increase the dose anymore.
And I take it if they are still not controlled, it's the point where you need to look further.
You need to look and see whether there is a concurrent disease. Sometimes Cushing's in dogs will definitely cause glucose to go all over the place all the time. We call it increased glycemic variability. So it's just from one day to the next, the glucose is very different. You may have one day where the glucose is really high all day. The next day it's completely fine. And the next day it's actually low. Or the next day it's going up and down throughout the day. So you need to potentially look for Cushing's, or if you have a dog where you give the insulin and the glucose drops, but then within 8 hours it's really high again and the dog's having a lot of clinical signs, we may need to talk about switching to a longer acting insulin. And that's when we talk about Diabetic or Prozinc, actually potentially once daily.
And looking ahead, what advances in diabetic care excite you the most?
Yeah, I think there's a combination. So again, I think the SGLT2 inhibitors in cats, which basically make cats pee out glucose, but then their blood glucose normalizes. That is the most exciting change that's happened since I've been a veterinarian. Oral medications for cats is literally life-changing and life-saving for cats whose owners weren't going to be able to give insulin. In addition to not having to give the injections of insulin, they're less likely to cause sugar to go low. So there's a lot less monitoring of blood glucose. So that makes life much better. The other thing is once daily insulins for dogs and cats. So in dogs, we'll use Diabetic, 2JO, or Prozinc once daily. In cats, potentially 2JO will work. In the United States, they're pretty, 2JO is really expensive. Diabetic's not. Again, I don't know the prices in South Africa. In Australia, 2JO and Diabetic are cheaper than the veterinary insulin, so they're good options. But once daily insulin, I think can be life-changing just because it improves quality of life. The owner doesn't have to worry about giving insulin at night. And then there's a study that's going to start soon. So this insulin is going to be years out, but for potentially an insulin that lasts up to a week. That's super exciting because that would improve everybody's quality of life.
That will be incredible. And how are you finding owners are managing, a little bit like owners are scared about injecting, with tableting their cats?
Yeah, it depends. So in the United States, we have two different options. We have Sinvelgo, which is an oral liquid. It's a solution. And then we've got Bexacat, which is a pill. So generally, one of those will work for cats. You can also, the Sinvelgo, you can put in canned food, the liquid stuff. One of my owners got some freeze-dried salmon treats and just put it into there. I have a bottle of it back here somewhere. They put it into the freeze-dried treat and the cat would eat it. The Bexacat is flavored, so you can grind it up and maybe put a little moisture on top of the dry food if that's what they eat, and then put it on the dry food. So most of the cats will tolerate one of those. Full disclosure, the company gives me Sinvelgo, so I use it the most here, but we have an owner, a veterinary student. They always have the most complicated cases. Anyway, that cat did really well on Sinvelgo, but the cat was hiding underneath the bed because the cat hated the liquid. So we switched that cat over to Bexacat, the pill, and the cat tolerates being pilled perfectly fine. So the short answer is, obviously, every cat's not going to tolerate it. I have heard of a lot of cats who will eat the Bexacat initially when they're diagnosed because they're so hungry, but as time goes on, they're less likely to eat it, and they either have to switch to putting it on the food or going to Sinvelgo. They go back and forth. It's really surprising. Yeah.
It's great that there are some options.
Our first thoughts, there are 6 of us on the advisory board for Sinvelgo. Our first talk with this company was like, do the cats actually tolerate this? Because we were all like, I don't know, I'd rather inject a cat than give a cat something liquid. And in their study, 98% of the doses were given appropriately. Now, these owners were very keen to have an oral solution for their cats as opposed to giving insulin. So I don't know that in the real world, 98% is an accurate number, but it's a lot better than I would have expected. I'll say that.
Oh, that does surprise me too. And finally, if a pet owner is listening to our conversation today, having just received this diagnosis, what would you want them to hear most clearly?
I think that it gets better. We have answers. We have some solutions. It is going to take some time. It's going to take some understanding. It's going to take some time for you to adjust to this. It's going to take some time for your pet to adjust to this. And obviously, it's going to be a condition that you manage long term. But these cats and these dogs can have great qualities of life long term. It's just going to take probably a couple months at least to get them regulated initially. So don't give up. Make sure you talk to your vet. Make sure you have conversations. Call when you have questions. When something's not going right with the animal, you need to talk to your vet. And I think a lot of people are scared too. You know what? Call up the vet clinic and talk to the nurse or the technician, and they'll help you with it. I think one of the most important parts of getting a diabetic animal regulated is how much communication there is between the owner and the vet. You have to notice, as I'm talking about this, there are times I've had to go back and redefine things because I'm realizing I'm talking to people that aren't veterinarians. So there are words, when I talk to my wife, there are words I use and she's like, what are you talking about? I'm like, isn't this a normal word? She's like, no. So my point is, there are so many things that we say that owners don't understand. We don't do it on purpose, but it might just be like that. So don't think you're asking us a stupid question. We usually feel bad that we didn't explain it the right way. So please ask your vet when you don't understand something, and they're generally going to be super happy and helpful to help you.
I agree. And I think, the nice thing now is that we are following up a lot of our advice, particularly when, they're presented with a huge amount of information with printed sheets and supporting information so that they can go home and digest it. Because I think a lot of the things, we like the communication and using vocabulary that just goes over their heads. It's also the sheer volume of information that if they can access that when they're home with the right person and have a discussion and then potentially even revisit or phone us.
Yeah.
That's making a huge difference.
That's a really important point I did want to draw upon. There is a lot of information available. You can find lots of YouTube videos that help normal people give insulin. I will say that there are a lot of support groups on Facebook and such that can help you. One thing I will say is when you go onto those groups, there are people on there that, I don't want to make this sound bad, but literally they spend their entire lives focusing on the diabetes in their cat or dog. And I've had one of my owners felt super, super judged when they went on there because they weren't doing everything perfectly. Absolutely go on there for advice and for help with things, because especially when things are going wrong in the middle of the night, those people can absolutely help you. But please do not feel guilty that you're not doing every single thing. Remember, my personal approach is we need to have a happy dog or cat, and we need to have a happy dog or cat owner or person owned by their dog or cat. That doesn't mean you need to be thinking about this 24 hours. And honestly, I'd rather diabetes is just kind of a side thing and not something you're focusing on. So that's one caution I want to give people is you don't have to think about this all the time. And please don't feel judged by other people that are thinking about it all the time, if that makes sense.
Absolutely. It's a very practical approach. Like you say, it can weigh heavily on owners such that, they, like you said, burn out or get to a point where they're just, I can't do this anymore. Either they're not managing things, as they feel is fitting in with their lifestyle, or, there's so much pressure to be feeding them at particular times and following instructions to the T. Are there any resources that, other than obviously groups that are out there that might provide valuable stuff, but like resources that are safe to refer people to, any university material or any nutrition sort of, does Royal Canin, or for example, or anybody out there have information about diabetes that is a good resource?
AHA does. American Animal Hospital Association should have some information on their website. from when we wrote the diabetes guidelines a few years ago. We're updating them right now. So they should have some owner resources on there. I'm trying to remember. There's some new feline diabetes guidelines. I can't remember the name of the group that makes them. But if you Google feline diabetes guidelines, there should be some resources associated with that as well.
Ideal. Thank you. Thank you very much for taking time out of your very busy schedule. I really appreciate this conversation. I hope my listeners have too. Taking a very complex subject and trying to just provide some clarity has been really valuable. So thank you.
Absolutely.
I really appreciate it.
Thank you for inviting me, and thank you for coordinating with our weird time differences.
Thank you so much for tuning into today's episode on the Pause and Effect podcast. If you found the discussion helpful, please like, share, and follow our podcast. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Jackson the Jack Rossi here, and boy, am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.